Did you know your feet can act as an early warning system for your health? They can show signs of problems long before other symptoms appear. Let's look at what your feet might be trying to tell you. First up, cold feet. If your feet are always cold, even when you're warm, it could signal poor circulation. Your heart might be struggling to pump blood all the way down to your toes. This could be linked to smoking, high blood pressure, or heart disease. It's definitely something to mention to your doctor. Next, swollen feet. We all get them after a long day, but if your feet are constantly puffy, it could be a sign of something more serious. This fluid buildup, called edema, can be related to kidney problems, heart failure, or liver disease. It's your body's way of saying it's having trouble managing fluids. What about your toenails? If they turn yellow and thick, it's often a sign of a fungal infection. While common, it's best to treat it early. Yellow nails can also, in rarer cases, point to lung issues or lymphedema. Ever feel that pins and needle sensation or numbness in your toes? This could be a sign of nerve damage, known as peripheral neuropathy. Diabetes is a major cause, but it can also result from vitamin deficiencies or alcohol abuse. Don't just shake it off. Get it checked out. Now let's talk about that sudden, intense pain in your big toe. If it's red, hot, and swollen, you might be dealing with gout. Gout is a type of arthritis caused by too much uric acid in your body, which forms sharp crystals in your joints. It's incredibly painful but treatable with diet changes and medication. What about cracked heels? While often just a cosmetic issue from dry skin, deep, painful cracks could be a sign of an underactive thyroid. Your thyroid gland controls your metabolism and skin moisture, so when it's not working right, your skin can become very dry and cracked. If your toes ever look blue or pale, that's a major red flag for circulation. It means they aren't getting enough oxygen-rich blood. This can be caused by something called Raynaud's disease, where blood vessels spasm in the cold, or it could point to more severe blockages in your arteries. Foot ulcers are another serious sign you can't ignore. These are open sores that don't heal, and they are a common and dangerous complication of diabetes. High blood sugar can damage nerves and reduce blood flow, making it hard for wounds to heal and easy for infections to set in. If you see one, see a doctor immediately. Are your feet often hot, itchy, or uncomfortably dry? Itchy feet could be from a fungal infection like athlete's foot. Hot feet might be linked to nerve damage or a vitamin B deficiency. And persistently dry, flaky skin, as we mentioned, could be related to thyroid issues. Finally, let's discuss dark spots or discolored patches on your feet or lower legs. These can sometimes appear when blood containing iron leaks from the small vessels. This is a sign of chronic venous insufficiency, where the veins in your legs have trouble sending blood back up to your heart. It indicates a long-term circulation problem that needs attention. Remember, your feet do so much more than just carry you around. They can give you crucial clues about your overall health. Paying attention to these signs allows you to be proactive about your wellness. This video is for educational purposes and is not a substitute for professional medical advice. Always consult with a healthcare provider for any health concerns. Thanks for watching. If you found this helpful, give it a like and subscribe for more health insights. Share this video with someone you care about. See you next time.